I think what I've heard over the many years, and I've been doing breast augmentations for 25 years now, and I've written most of the chapters in textbooks on breast augmentation. I'm always surprised that so often people that I talk to don't want to do a breast augmentation because they think it's going to look fake. And the truth is, the vast majority of breast augmentations, it'd be really hard to know the patient had a breast augmentation. They look very natural, very proportional. We put in very modest size implants that really just fit the patient's frame. It's the obvious over-augmented, very high fake look that turns our attention and catches our sort of looks at them, and we say, oh, wow, that's a breast augmentation. I don't want that. But that's not what most patients look like. The fact that you've seen so many patients and so many people with breast augmentations and you don't even know it points to the fact that breast augmentations are generally very natural looking and very hard to tell. When you do a breast augmentation, it's augmenting your natural breast. And so always the final breast is a combination of a patient's breast tissue, their natural breast tissue, and the implant. So for somebody who wants to have more of an implant look, we're going to have to place a larger implant in that basically overwhelms their own natural breast tissue. If we want it to look more natural, then we'll respect their amount of breast tissue and only add some volume to enhance their natural look. So I think that it's important to really remember that in a breast augmentation, it's not just the implant. You still always have your own breast tissue at the same time to help soften and give that very natural, more proportional look for you. Over the many years in my career, we've been all over the place as it relates to saline and silicone implants. When I started practice in Louisville in 1997, really we could only place saline implants. And so I did thousands of patients with saline implants, but I also did the FDA trials for the adjunct study for silicone implants. In 2006, we were allowed to start placing silicone as well as saline. Over the last decade or decade and a half, silicone implants are by far the most common implants placed in women today. They have the same safety profile as saline implants. So silicone and saline are very equal in that way, and yet they have a much more natural result, and they are not as heavy. They don't jiggle as much as saline implants. They're more cohesive, and they provide a softer, more natural shape. So silicone implants are definitely, for most patients, are preferred. The people who I would tend to put saline implants are people who have fear of silicone implants, or maybe they're very young and have not had children yet. Maybe they're less than 22, and their breasts are firm. I think those patients would do very, very well with a saline implant. Maybe after children and when they need to change their implants, they may choose to have silicone implants at that time. But remember, silicone implants are just as safe as saline implants. One of the most important aspects of getting a great result in breast augmentation is in choosing a surgeon that's qualified and good at breast augmentation. So looking at reputation, but also looking to make sure that the surgeon that's going to do any patient surgery is board certified by the American Board of Plastic Surgery. That's the only board that matters as it relates to breast augmentation. Also, the surgeon needs to have a lot of experience in breast augmentation, hopefully in breast lifts, in revisional difficult breast surgeries, because sometimes cases are easy and sometimes cases are more challenging if you want to get an A+ result every time. So the surgeon's experience and their qualifications, training, and credentials, including board certification, are all extremely important for a successful outcome with breast augmentation.